So the major problem of kidney disease in the world today is.
Can you explain what this means and what's the importance of this?
In CaReMe, there are three components.
From a kidney's perspective, how do CaReMe disease impact patients? Are diabetes also increasing in younger people generation?
Very common in 20s and 30s, and type 2 diabetes nowadays we see even in teenagers.
Tell us what are some early warnings of a heart disease?
Breathing difficulties, chest pain.
And that's why we are now seeing the kidney disease on the rise.
Do you see this reflected in your clinical practices?
Actually, diabetes is not a disease.
What's one piece of advice?
I think for me, it's the prevention and prevention and prevention.
Hello and welcome to the special podcast on CaReMe disease. If you or someone you love is having a problem like diabetes, high blood pressure, heart disease, or a kidney problem, this episode is for you. CaReMe stands for cardiovascular, that is heart, renal, that is kidney, and metabolics, which is diabetes or related conditions. These diseases are not separate, rather they're deeply connected. To help us understand this better, we have three specialists with us today. So Dr. Prakash Kumar Hajra, a heart specialist, Dr. Ranjan Sarkar, a kidneys expert, and Dr. Rana Bhattacharya, a diabetes and metabolic specialists. So many people think of heart disease, kidney disease, and diabetes are of different conditions, but they are a part of CaReMe disease. So, Dr. Hajra, can you explain what this means and what's the importance of this?
In CaReMe, there are three components: C for cardiology, R for renal, that means kidney, and M for metabolic.
Yeah.
So these are interrelated and they have a crosstalks. Now the metabolic organs are little different from the cardiac renal organs, like basically is liver and beta cells, etc. So C, cardiology definitely has very strong relationship with kidney as such. And if you consider metabolic disease and endocrine and diabetes, all three organs are strongly interrelated in terms of disease progressions and the ultimate sufferings of human beings.
Okay, that's a great point. So, Dr. Sarkar, from a kidneys perspective, how do CaReMe disease impact patients?
Like as Dr. Hajra just told you, that these are all interrelated. So the major problem of kidney disease in the world today is now diabetes. And the second most important cause is hypertension. So both diabetes and hypertension, they affect the health in a total and kidneys in particular. And that's why we are now seeing the kidney disease on the rise, because the diabetes is rising in the population and so is hypertension. And this can cause heart disease, and heart disease itself can also deteriorate the kidney function. And this also increases the risk of cerebrovascular disease and stroke.
Okay. So, Dr. Bhattacharya, since metabolic issues like diabetes are the center of CaReMe disease, so how should people think about them?
Right. So diabetes as such, it's a metabolic condition and the central part of it is increase in blood sugar. But that's not all. As our other experts have pointed out, that increased blood sugar and other consequences of this diabetes leads to problem in different organs, heart, kidney, and other parts of our body as well, like our eyes, our nerves, increased chance of infection. So this diabetes and high blood glucose, it basically plays an initial part and central part in this whole CaReMe condition.
Okay. So, we keep hearing that heart disease, kidney disease, and diabetes are actually rising in India. So, the part is how bigger is the problem? So, Dr. Hajra, can you share some insight on the burden of the CaReMe disease?
Look, as we have started discussing about the interrelated issues, If the heart disease is increasing, if the diabetics are increasing in number, so the renal disease. So all these diseases are on rise across the globe. And if you include the pollution, CRMP, or stress, PES, so these are the things on rise. Hypertension, so these are the diseases which are having increased incidence than before. So there are some issues in the society, the lifestyle, um, good living, affluence, lack of exercise, smoking, alcohol, etc., etc. So in summary, I think you are very appropriately asked this question that as a whole on the globe, CRM is on rise.
Right. So all of putting all together, it also depends on the lifestyle and
Yes.
how people want to remain healthy. So, Dr. Sarkar, do you see this reflected in your clinical practices?
Yeah, this is a joke. One of my seniors told me that the day all the patients coming through the door will have diabetic nephropathy as the diagnosis, he will retire. So that's how explosion of diabetes related kidney disease has become. Now, just a small addition to what Dr. Bhattacharya just said in the previous answer of the previous question. Actually, diabetes is not a disease. Now, what we are talking about today is not CaReD. We are talking about not cardio-renal diabetes. We are talking about cardio-renal metabolic. So it's not the sugar which is the main problem here. And we don't know when a type 2 diabetic has become a diabetic because there is no immediate problem in the health. And that's why this metabolic syndrome, soon the type 2 diabetes will be replaced by the new diagnosis of metabolic syndrome. Most of my patients are diabetic or hypertensive or they have heart disease. And that's part of the metabolic syndrome and their complications.
Right. So we see that it's all interrelated.
Absolutely.
So, to Dr. Bhattacharya, are diabetes also increasing in younger people generation?
Yeah, definitely. I mean, say around 30 years back, uh, young patients, they rarely had type 2 diabetes. So there are many types of diabetes, at least 50 types, but type 2, as you know, it's the commonest one. Around 95% of all patients with diabetes are having type 2 diabetes. Now, in the last 10 years or so, we are seeing more and more younger individuals getting diabetes. It's very common in 20s and 30s. And type 2 diabetes nowadays we see even in teenagers. So it has become very common in younger individuals, possibly due to drastic changes in the lifestyle that has happened over the last few years or so, regarding both diet as well as physical inactivity.
So, many people ignore health issues until it becomes serious. So, Dr. Hajra, if you could tell us what are the some early warnings of a heart disease?
Look, sometimes heart disease come alone, but most of the time do not. So if you're talking about pure heart disease, it comes in the form of some chest pain, fatigue, breathing difficulties, losing weight, and loss of consciousness. So these are the usual, almost 90% of cases. There may be certain other issues like gaseous sensation suddenly coming after having meal, or all of a sudden you are coughing and that disturbs your sleep, leg edemas, leg swelling, not able to eat, not able to speak, urine output is going down. And in many cases, again, the interrelationship of different diseases come into play. So once heart disease doesn't mean you will stay with heart disease only. Once diabetes doesn't mean that it will stay with diabetes only. So diabetes as such do not cause death, but it does cause death by having heart disease. So heart disease ultimate reflections of renal failure or pancreatic failure or muscle failure or other forms of CRM. So there are many symptoms, but in essence, it is the suddenness of any disease which is coming below your chin, above your umbilicus. Take it for granted that it is heart disease symptom, be it pain, be it undue gaseous sensation, and a vague feeling. So all these are heart disease symptoms.
Okay, that was pretty insightful. So, Dr. Sarkar, kidney disease do not always have symptoms early on. So, how should people think about it?
Absolutely. God has made us wrong. If you have heart disease, you have got angina or problem in exercise and all these things. For kidneys, unless the kidneys are down by 70 to 80%, you don't have symptoms. So if you are at risk, there are 5, 6 categories. If you are at risk, if you have diabetes, if you have hypertension, if you have heart disease, if you have a history of kidney disease in a first degree family, in relations, if you are age above 50, then you will have to look for the kidney disease. And now, even before the blood test, the creatinine, as we know, is the marker of kidney disease. Creatinine is a late marker of kidney disease. So you need to check your urine, and you need to check your urine for protein leak. So there can be a major protein leak, which is detected by normal urine test, or there can be a minor urine leak, which we call microalbuminuria. That's the first stage in kidney disease. So everybody at risk should check themselves every year for appearance of microalbuminuria. And what are the symptoms? If the kidney disease advances very far, you can have retention in water, the urine volume goes down. There can be frothing in urine, which is essentially protein in urine again. There can be decreased appetite, and there can be fatigue, because these people also become anemic, because one of the functions of the kidney is to produce the red blood cells. And you can have reduced appetite and nausea, and finally vomiting. So we rarely see people coming to us with these end-stage kidney disease symptoms. But mostly now the awareness has increased in the population, and in at-risk patients do check their kidneys, and they come to us even with just proteinuria. And it's very easy to treat if we can get the patients that early.
Okay. So, Dr. Bhattacharya, how can someone know that if they might be developing diabetes?
Right. Again, very important question. Basically, there are some symptoms of diabetes which are very typical, like a person is feeling excessively thirsty, having to get up multiple times to urinate from bed, or developing some infection, maybe skin or somewhere else, which is not getting healed rapidly, losing weight, increase in appetite, feeling hungry always. So these are the classic symptoms of diabetes. But it's very, very important to remember that these symptoms are not very common. It's a common misconception that unless these symptoms are present, one doesn't have diabetes. It's not so. Around 7 in 10 individuals with diabetes may not have any symptoms. It's absolutely silent. So as I previously said, that diabetes is occurring in more and more young individuals. So what we ask all the physicians and the population at large, that you should screen yourself even if there is no symptoms from at least 30 years onwards. And maybe even earlier if you have some other conditions like high blood pressure, like some nerve problems, like history of diabetes in your family members. There you can start screening even earlier. So it's a very simple blood test that can be done, just maybe a fasting blood glucose level. So that's all need to be done for screening. You don't have to wait for symptoms. So always start from 30 years onwards. If there is the blood glucose is normal, then you can recheck every 3 years. So it's very, very important to screen oneself for diabetes. You should not wait for symptoms, but if symptoms happen, definitely consult your physician and get the blood test done for sure.
Okay. So we've already talked about problems. Now let's talk about solutions. So treating CaReMe disease means addressing heart, kidney, as well as metabolic health together. So Dr. Hajra, what does an effective CaReMe treatment plan looks like?
Look, if you're talking about the problem and disease, then you should also talk about hopes and solutions. Nowadays, most of these diseases can be prevented to large extent, as my friend Ranjan has mentioned, that many times they do not come with florid symptoms. But you should not ignore the minimal symptoms of kidney disease or diabetes. Somebody is feeling thirsty, polyuric, they should consult diabetologist. Some swelling of the leg, they should consult nephrologist. So there are treatments available, and nothing can beat the spirit of life. You should stay happy, healthy, positive thinking, because there is no prosthesis for amputated spirits of life. So happiness, depressions, pollution, these are the factors. Social factors should be under control. Then the question of diet and medicine comes. Diet is very important for three specialists sitting here. He talks about diet, diabetologist talks about diet, we also talk about diet. So diet is a common thing for all CRM patients. Exercise, no smoking, blood pressure control. Now what's new? The new is, you can bring down your cholesterol by an injectables now, some oral statin, cholesterol lowering agent, triglycerides should be lowered down, and LDL cholesterol should be lowered down as low as possible, drastically, hit hard, hit early, with safe agents. Second group of agents are basically anti-metabolics or anti-diabetics per se when it was discovered. But nowadays, like there are some medicines called SGLT2 inhibitors, GLP-1, incretin based therapy. These are the medicine which can cure diabetes if you lose 30, 40%, 50% of body weight. That is the reality now. Diabetics can go into remission. But once you have heart disease or kidney disease, nothing in this world can completely cure that disease except pacemaker. So you have to retard the progression of disease by antihypertensive drug, good anti-diabetic drug, good control, early control, better control, safer control, with many medicines. Like if you can treat tuberculosis with 4 drugs, with COPD with 3 drugs, why not CRM with 3-4 drugs, which is basically now called fixed drug combinations. Like one drug cannot control all these diseases. So it is a combinations and permutations of understanding the disease. That's why the patient should consult the specialist. Once they have one problem, the other problem is in hiding. And there are some treatment which is shared by 3 of us. And these are all attractive, available solution to CRM patients. So in summary, there are medicines, there are injectables, there are vaccines, there are lifestyle modifications. This is meant for everybody.
Okay, great. So, Dr. Sarkar, if you could, elaborate on the kidney protection.
Yeah, I mean, in 1990s, we had a first group of drugs which actually showed that other than controlling blood pressure or other than controlling sugar, there are medicines which can retard the progression of kidney disease. And then for 20 years, we did not have any new medicines. So we were just practicing the same thing for the last 20 years. And then came the panacea for all, the SGLT2 inhibitors, as Dr. Hajra was talking to. Dapagliflozin and empagliflozin are the 2 main drugs, which are now being used by the nephrologists for all diabetic patients and for all kidney disease patients, except a couple of specific diseases like autosomal dominant polycystic kidney disease. That's a specific contraindication of using this drug. But now this drug has changed the game plan completely. So previously there was no hope for kidney disease patients, only to wait for dialysis. And now, the earlier we use this drug, we can delay the progression of kidney disease by many, many years. And mathematical calculations have shown from different scientific studies that if we can start this drug with minimal kidney filtration defect, which means that creatinine is normal and there is only proteinuria, which is the earliest stage of diabetic kidney disease. And if we start them, the SGLT2 inhibitors, then it can delay your dialysis by 15 to 20 years. That's a long, long time. So if I get 15 to 20 years of dialysis-free life, who knows what will happen in between to me? And there is a third drug which has come up very recently, which is also good for Dr. Hajra, especially in poorly functioning hearts, like with, as we call them, as reduced ejection fraction. And they are also very good for kidneys and for those people who are leaking proteins. But till now, that drug is only available for diabetics, not for other kidney disease. Research is going on whether we can use it in non-diabetic population as well.
So since we are talking about protecting our kidney and heart, so Dr. Bhattacharya, I would like to ask you, what's the best way to control diabetes?
Right. Again, I would just agree with my two co-panelists that basically lifestyle is the key. So that's the first thing to be done. That means a balanced diet to maintain a normal body weight as far as practicable, regular exercise as much as permissible for that individual, and then medicines to control blood glucose, to control blood pressure, and to control cholesterol. And on top of that, as both of them have mentioned, that now there are some drugs which, in addition to controlling all this, also benefits kidney and heart in their own way. So a comprehensive treatment plan starting from lifestyle changes to control of blood glucose and to controlling other associated factors that will lead to good outcome. And we have many options available now, fortunately.
Okay. So before we wrap up, what's one piece of advice you would want us to give in terms of CaReMe disease?
Yeah, it's as we are discussing the three factors, CRM. So basically now we are saying you can kill three birds with one stone or three devils with one arrow. And as we have discussed that diet and other therapies, which is applicable for one disease, is also applicable for other diseases. And they are interrelated, and there are crosstalks between these organs. Liver talks with your heart, kidney talks with your heart, and the muscle, pancreas. So metabolic organs are many in numbers. So that is basically expanding every day, every month with your understanding. For example, your brain controls the satiety, the hunger, the fat content, the eagerness of smoking, alcohol, the vices of life. So if you can control your satiety or you control your brain emotions, so other vices can also be controlled. So in one word, I would say there are therapies and it should work as a team, that many diseases where the complications are havoc in patients' survival, they should consult at least once in their life a nephrologist, a cardiologist, a diabetologist, and vice versa. Thank you.
Dr. Sakar?
I think for me, it's the prevention and prevention and prevention. So look for the kidney disease, you search it out and diagnose early. And I think the patients have to take some responsibility on themselves. Even if we talk about this urine test in every forum where we can. So testing urine if you are at risk to develop kidney disease is very important. If you want to go back and listen to this, you can visit the website called worldkidneyday.org. And there is a comprehensive literature for the patients on how to prevent kidney disease who are at risk. And they can go look up as many times as they want to. But it is to find out whether you have got a kidney disease and then go to a nephrologist.
Okay, Dr. Bhattacharya.
Yeah, screen timely and regularly as needed. Number two, if you have this one of these CaReMe component, you should treat with medicines regularly, and you should monitor the outcome as advised by your physician, like measurement of blood glucose or cholesterol or cardiac conditions, whatever is advised. Along with that, maintain a lifestyle change, including diet and proper exercise. That's it. Thank you.
That's a fantastic advice. Thank you, doctors, for joining us today and your insightful discussions. And to our listeners, your health is in your hand. So focus on your CareMe health, take small steps today, and protect your future. See you next time.